Hello, and welcome to today's episode of the GynoBits podcast. I'm your host, Dr. Susie Weber, board-certified gynecologist and menopause specialist. On the GynoBits podcast, we'll cover women's health issues with a focus on menopause, vulvovaginal conditions, and sexual health. Hello, everyone. Welcome to the GynoBits podcast today. Today, I have the pleasure of speaking with Dr. Gail Miller. Gail is a maternal-fetal medicine specialist and life coach. She's also a TEDx speaker. She is also the founder of Path Onward Life Coaching, and her mission is to empower women who are childless, not by choice, to feel worthy, live fulfilling lives, and manage triggers and fears. Gail, thank you so much for joining me today. I've been looking forward to our discussion for weeks now. It's such a pleasure to have you talk about such, I think, an underrecognized topic. Can you share a little bit about yourself and how you got to this point with us?
Sure. Yeah. Well, thank you so much. I've been looking forward to this too. So thank you so much for having me on here and for giving this topic a platform, a voice. So really appreciate it. People will often point out to me the irony of me being a maternal-fetal medicine doctor. So I, take care of women who have high-risk pregnancies. And I am also childless, not by choice. This was not what I had planned for my life, but this is where I am. I had I don't remember a time when I didn't think I would become a mom, like since childhood. And part of it was kind of aging out, if you will, not meeting the right partner at the right time. I had fertility issues. And then when I met the right partner, the fertility issues only got worse. And he had kids and was like, this is not, I don't want any more kids. He did the terrible twos. He did the teenage years. He's like, I'm done. So this is where I am. And before I met him, I had gone through this okay, maybe I'll try to do this as a single person. I had family situation and work situations that made it I just decided I couldn't do this on my own, and I would have had to do it completely on my own, and I would have gotten fired from a job that I was at. I had a very conservative boss. And so I kind of over time was like, okay, I'll move on with this and not have a child. And I've accepted it, or at least I thought I did. And I didn't, because when I met my husband, like that desire resurfaced. And as I said, it just wasn't like the fertility issues were getting in the way, and he didn't want to have any more children. So it was then that it just all hit me. And I walked around for quite some time, living my life with this smile on my face and feeling like empty inside, and not really, and feeling cranky, like always having to cover up my crankiness and not knowing why. And then I had this one day I was working on my computer and I had a memory, a notification popped up that there was a new memory, photo memories in my email. When I looked at the photos, there was one that really struck me because I looked so happy in it. And it was like, that's not me. Like, I don't feel that way. What happened? And when I studied it, it was like, oh, that was from before the time when I realized I wasn't going to become a mom. And that's when I also knew, okay, I need to change this. I need to move my focus from this. I'm grieving, but I didn't really recognize it, and really change my focus from, instead of looking at what I don't have, to what I do have. That's not to say, like, some people will take that as, oh, then, you're just into this positivity. No, it's not that at all. I feel the pain, and I've learned to also embrace the good that I have in my life. So, long story to get to, I had worked with a therapist, I worked with a coach. They were both wonderful. Neither one was childless. And my therapist actually said at one point, well, I know what you're going through because I had a high risk pregnancy. And I was like, okay, no, you have grief from that. I totally get that. Your pregnancy didn't go as you planned, and that you do grieve over that. But it is different than this grief. It's not worse, it's not less, it's just different. So that's when I was like, I need to do something for other women. Coaching is what helped me the most when it came to my childlessness. And so that's when I was like, I need to become a life coach, and I need to make my practice focused on women who are childless, not by choice, because while we all have different circumstances, like I walk that same path of that same grief. And I'm not going to say to someone, oh yeah, I know I know what you're going through, because nobody knows what anybody else is going through, whether it's childlessness or anything else. So that's when I decided I need to become a life coach, and I became a life coach, and I continue on with other training because I don't know if it's the doctor in us or whatever. Like we always have more and more training, and I just feel like I continue to do other courses and certifications, so I have like the most tools available to help my clients. That's where we are.
Yeah, I think that is so important that you realize that. And I think you're the only life coach that I know in that space. And I think really that's a good point, that we can kind of see what someone's going through, but to really have someone that's walked that similar journey to really understand what you've been through. I think that's huge, and happy that women have that in you. I always hear about your most important certification is probably your life experience. And so just having gone through that is probably the most important. But yeah, definitely the doctors, we're lifelong learners. We just want to learn more and more. And thank you for sharing your story. I think it's amazing. So, I think as OBGYNs, we have a lot of empathy for our patients and we're very sensitive, but I think that this is definitely kind of an under-recognized area. When we have someone in the office that's going through fertility treatments or undergoing IVF, it's really at the forefront. And so we're thinking about it, we're sensitive about it, we're, think it's right there. So we're dealing with it. But then we oftentimes sort of forget about that in somebody's past. Someone may come in their 40s or 50s, and we're not really thinking about that, but it can still be so deeply impactful for that person. And I recently had a patient in mid 40s that had abnormal bleeding and ended up with a hysterectomy. And she had kind of a rough first interaction with us. And I think we were trying to figure out why she was sort of standoffish and almost irritated and hostile. And it was because she had kind of gone through this journey where she just always envisioned herself being a mom, and it hadn't happened. And then, she and I fortunately were able to communicate, and she shared that information with me. And really, it was hard for her to come into our OBGYN office and see these pregnant women sitting in the waiting room. And, that really brought that to the front of my mind once I saw that, because we just sort of forget about it. Someone in their mid 40s, you may not even be thinking about that. Do you have any particular thoughts about women in different stages of life, the perimenopause, menopause, after menopause, where this experience of being childless, not by choice, may be different or approached in a different way?
Yes, I do. So there's not particularly like especially discrete stages, but based on like what you've been going through in your age, things do change over time. So it's sort of that acute phase, if you will, when you have been going through fertility treatments that weren't successful, or you did not go through fertility treatments and you've decided I need to accept this. So it's that sort of acute phase where you're learning to accept it, learning that acceptance doesn't mean I'm happy about this or I'm okay with this. Acceptance is really just stating your reality, which is I don't have children and I won't have children. But getting to that point can be especially difficult. And there's also a misunderstanding often of what acceptance is. Like I said, some people think it means, oh, I'm saying I'm okay with it. Or like, if I'm accepting it, am I being disloyal to the child that I dreamed of, or my own dreams? And that's not the case. So that makes that acceptance more difficult till, you can really truly feel that, okay, this isn't me saying I'm okay with it. It's just this is my reality. And then it's like you kind of have to not separate yourself, but learn how to divide your time. Okay, in a way, it's kind of like, I can't think of the word right now, but like in Judaism, when somebody dies, we sit Shiva. It's like this mourning period of, okay, it sort of separates the life from the after someone passes. And so for some women, it's that go through that stage of doing something that represents an ending. So some will take they still have syringes, they'll smash them, or some will take their, like, after visit summaries and start a bonfire safely. But it's just, and
Yeah.
some will go on a hike or take a trip, and it's this like separation of, I'm saying goodbye to the me that was planning on becoming a mom and the me that is not going to become a mom. So there's that sort of goodbye, if you will. And then there's just different time, sometimes Mother's Day, well, Mother's Day is a whole nother topic, but sometimes like you'll get invited to something like a shower and you feel fine going, and sometimes it's like that's a huge trigger. And then as you age, it kind of becomes this thing where for many women, it just sort of happens. There wasn't okay, I'm not going to have a child. It just sort of happens. Like it happened over time, but now there's this sudden realization. And then you have these periods where you get triggered. And menopause is one of those triggers, because it's, when I turned 50, it's not like at 49, I didn't know I wasn't going to have a child. But 50, like, it really hit me. And that was a horrible birthday for me. Even though, like, 49, I'm not going to have a child, but 50 for some reason for me was this awful, awful birthday. And so sometimes with menopause, like, there are certain things that just really trigger new things, new fears, like, I'm getting older, who's going to take care of me? Not that anybody has a child, so you have someone to take care of you, right?
Right.
And we all know of, seniors who have children who have nothing to do with them. But when you're childless, I'm not going to have anyone to take care of me. And menopause is a big trigger for that. Now, I do have clients who think about it earlier, but menopause is like just this like flashing light at you. You won't have anyone to take care of you. And so, yeah, there are different stages. And then now you are seeing your friends not just have kids, now they're having grandkids. So, by default, you're grandchildless, not by choice as well. So, yes, there are different stages. They're not always discrete, but women do have these ups and downs, and it has to do a lot with where they are on this journey. I don't know if that answered the question.
No, it did, definitely. I think because you just think about the childless aspect of it, and maybe not, like you said, down through the decades of what your life looks like and how that impacts going forward to the end of life. Definitely. I just think people don't really think about it. You talked a little bit about relationships and couples, and that fertility journey in and of itself can cause so many issues, or if there's a couple that's lost a child, that causes so many issues. What kinds of things with couples and their relationship have you seen with your clients? Because I think a lot of times, it impacts the woman, of course, but it can also impact their partner.
Yes. So it can be a huge struggle in relationships that sometimes leads to ending relationships. It could be because someone is looking for a partner who they can have children with, and that it's not just, a male leaving a female. Sometimes it's a male factor that's causing the infertility, and it leads to a breakup where the woman is looking for another partner. So it works both ways. This isn't it's such a it had such a huge impact on an individual's emotional well-being. And of course, we know when that happens, it can affect all relationships, work, family, partners. And so there are often people who are on very different pages. Men typically, not always, but men typically move on from it more quickly and tend to, I want to say, get over it, even though you don't really get over it, but they just seem to be able to put it in the back of their minds and not let it affect how they function and how they feel. Sometimes you think it's not affecting how they feel, but it is. And that in and of itself can create an issue if a male is still grieving but pretending he's not, and that leaves his wife or partner feeling like, what's wrong with me, or how have you moved on? And that creates problems as well. And it's the same issues, in couples, whether they're heterosexual or homosexual. One partner often kind of recovers, if you will, or moves on with it at a different rate than the other. And that can cause a lot of resentment between the two. So yeah, it has a huge impact. It impacts relationships also with parents, because sometimes there's this guilt that I'm not giving you a grandchild, or the parent will guilt the child and tell you, you've given up, why don't you keep trying? It's like, okay, well, you try one round of IVF and tell me if you think it's nothing. And it's everybody comes from a different situation. They may have done many years of IVF, but people who have not gone through this, or are not in their shoes, I should say, because there are people who go through IVF and they were successful and had a child, and will tell someone else, oh, I would go through it again. So you're never in someone else's shoes, but yet you'll have family members telling you, judging you and telling you the things you should do, or you're giving up. And so it affects so many different relationships, even working relationships, because a common topic of conversation, at lunch or what, is your kids. And so that can lead someone to feeling like an outsider, like not included in the conversations. So it affects relationships on so many different levels, but definitely between a couple, if one is moving on at a different speed than the other one is.
Yeah, it affects so many every relationship, really. Do you work with a lot of couples, or is it generally you work with the woman and then she may choose to bring your partner in on it? Or
so primarily I work with women. If they do want to work as a couple, typically if it's something that's really affecting their relationship, I will usually refer them out, because that's not my area of expertise in terms of couples coaching. But if it's something where, she'll want her partner to like just hear what I have to say, then, yes, she will bring him in, or if it's a female partner. But typically, if it's something where it's truly affecting their relationship, I do refer out. Yeah, did that answer?
yeah, that makes sense. I mean, it can be helpful maybe for partners just to hear from an objective third party what she's experiencing. But yeah, and then more formal marital couples counseling, and That makes total sense.
Yeah.
And then a little earlier, I talked about patients being in OBGYN offices. And, I think that can be really tough. But that's just the way women's health has been. Obstetrics and gynecology, most practices are going to be that combined practice. Do you have any thoughts about how we as physicians and providers can be more sensitive to the needs of our patients in that situation?
Yes. So what I tell clients and my social media is, unfortunately, there's no way to avoid all triggers. I mean, in order to do that, you would have to isolate yourself, which is not a healthy way to live. But there are also stages that you go through where you can deal with things in a little bit, it feels less challenging. So for those who, like, a OBGYN visit is particularly challenging, I would tell them to reach out to the office, see if you can get in at a time, like maybe it's the very first visit of the day before other people are there, the very last visit of the day. And so I tell women to reach out, and hopefully they're seeing someone who is, has that empathy, can really understand what they're dealing with. For doctors, for OBGYNs, I would say to have that understanding that this may be a huge trigger for someone. And while, again, I'm opposed to trying to get rid of staying away from all triggers, because you just can't in a healthy way. I also know that if they're particularly triggered, that is not going to be an effective visit on either end, right? They're not going to be able to answer questions. They're going to be sad, angry, frustrated, all of the emotions, and they're not going to hear you. They're not going to give you the information you need. So I would say to OBGYNs to please have that understanding that this can be particularly triggering. So invite your patients to let you know they need, what they need. I need to come in first thing before everybody else. Or can you please, even if it's not room, put me in the exam room right away, because you may not have one available. Is there someplace else I can sit where I'm not surrounded by pregnant women? So the best thing OBGYN practices can do is to make sure your patients know they can ask for this, to invite them to ask for it, not just be like, oh, we'll be open if you ask. Let them let them know that if they're dealing with infertility, if they're childless, not by choice, that please let us know what you need to make this visit less challenging for you.
That's helpful. It's hard to have to think about how to streamline that into maybe something in paperwork, or when people call, if there's anything, ask them about concerns for their visit and things like that. A lot of times we have different entrances and exits if a woman's going through something particularly challenging and they don't want to go back to the waiting room, and we try to be cognizant of those situations as well. Is there any way you think in our interviewing of patients that we can ask about that in a sensitive manner? And do you think better for us to recognize if they have children, and is it by choice or not by choice, and some way where they're not going to feel judged? Or
yeah so
maybe judged is the wrong word, but you know what I mean, just so it's not going to upset them, or a really neutral way to ask that.
Yeah, and you're right that you're not doing it to judge someone, but on the receiving end, it can feel like you're being judged.
Mm-hmm.
And this has actually come up a few times in physician groups, when for some of the women in their 30s, when their primary care doctors or their OBGYNs are bringing up egg freezing, and they're not, and they feel judged, like they're being told you should have a child. And so this is similar. My answer is to preface whatever you are going to bring up with, I have to bring up, or as part of your care, and it's important that we know, do you have children? Is this by choice, not by choice? not asking to judge you, but I'm asking so that I can be a resource for you, so that we can be sensitive about it, or something to that effect. So I always start out, even when I'm with patients and, a topic comes up that's difficult, like if I have to talk about their weight, I always preface it now with, I want you to know I'm not judging you. I have to bring this up because it's part of your health. And so I think the same kind of terminology, however it feels comfortable to you, because of course we all see things differently. But just let them know from the start, this is about your health, and I'm trying to be sensitive to it, not trying to judge you in any way. And I would add, I'd like to add something to consider is to put on websites. We know there are triggering situations, whatever, there's sensitive topics, because it's not just childlessness and infertility. Right. If you've been through cancer treatments or whatever, just a blanket statement. We want to be sensitive to all of you, or you've had trauma, you've, been assaulted, whatever it is. Just a statement on a website that we understand people have triggers. And so please know that we are open to you letting us know about this, so we can do whatever you need to feel comfortable for this visit. And so that can apply to anything.
Definitely. Yeah, definitely in OBGYN. And I think we've incorporated the trauma questions and abuse questions and things like that. And, we need to know if someone's sexually active, or how many partners they have, because we need to know how to care for them and what their sexual orientation is. Like you said, history of cancer. I mean, everything is really important, whether it's truly something medical or emotional or social. It all, is so interconnected. But
yeah,
that's a really good idea. I like that. I'm keeping track of all these ideas. Is there, I think we talked about the age. I had questions about maybe just general advice for family and friends, because like you said, it's just the water cooler talk, family talk. I don't know that you have any other advice about that.
Yeah. One is, my advice is to not give advice. So people love to be like, yeah, like, oh, my friend is going through fertility treatments, she has this oil, or whatever it is, or, this treatment, whatever it is. I guarantee you, if somebody who's going through that, they've read all this stuff, they've, looked at all the different options, and they don't want advice. Now, if they do, they'll ask you. The simplest thing would be, just to say, hey, I'm here for you if there's anything you want to talk about, or how can I help you? Sometimes asking questions is like, you just don't know what to say. Right. So that would be my biggest piece of advice, is don't give advice.
I think that's great advice for so many things, and it's hard because sometimes you don't want to not ask a question about how someone's doing, because sometimes that's worse. If you're ignoring it, then you almost feel like you're making it into this taboo thing and they feel weird. But at the same time, you don't necessarily want to pry and upset someone or trigger them in that situation. But yeah, so many times people, I think, will be well-meaning, but they're giving this advice and it's actually just backfiring, definitely. Yeah. So, but maybe just, how are you doing? Where, if you need anything, I'm here, and not be trying to say, oh, I did this and my friend did this. And I think people think that that's helpful, but generally not. So,
yeah. And I would also add that, if it's a situation where, like, there's a baby shower that someone's being invited to and they decline, just be understanding. Oftentimes what happens, people will be like, well, if it was me, I'd go, how selfish of you. Well, you don't know till you're in those shoes. And it's not, and they'll, accuse people of being jealous. And the reality is, it's not jealousy, it's grief. It is possible to be really happy for your friend, family member, whoever, that they are pregnant, that they're having a baby, and grieve for yourself. So one, I would say, please stop using the jealousy term, because it's typically grief, and just be understanding that you're not in that person's shoes. So you don't know that you would go, and, and so just be understanding and have a little empathy.
Yeah. Yeah, I think that's great advice, looking at it from somebody else's perspective. A lot of times we just make it about ourselves. Somebody's acting irritated, or we just assumed that we had done something wrong, or what did we do, and it wasn't about us. I think that's 90% of life stuff is not about us. It's about the other person, what's going on with them. And I think that's really great advice. Now, obviously women can work with you, and I'm going to get your information in a few minutes about how women can reach out to you, find your webpage and all of that. But do you have any general resources or web pages or other groups that you feel give good education about these issues?
Yes. So for me, for anybody who wants to get in touch with me, it's the easiest is pathonward.com. That'll get you to, you can send me a message. I have a mini course. It's free. It's actually about how you deal with healthcare visits because there's often a lot of insensitive comments and questions that are asked. Not necessarily OBGYN visits, but it's kind of amazing to me the visits women will go to that have nothing to do with their fertility, and someone will bring it up for no reason. It's not clinically relevant. So anyways, I do have this free mini course if anybody wants to know like how you prepare yourself for these visits and help the healthcare person to be more sensitive and in dealing with this. There's also, so for those women going through dealing with infertility, there is Resolve. It's a national organization. There is I Was Supposed to Have a Baby, another wonderful national organization. And there's also Dr. Kate Chandler. She is a fertility coach, life coach. She has gone through IVF herself. And Sonder Sisterhood is a wonderful group for women who are both single, not by choice, and childless, not by choice. And again, my life coaching is Path Onward Life Coaching. So for women who are childless, not by choice.
Yeah, that's good. It sounds like we're getting more resources that women can turn to, kind of finally pulling off the covers and letting people know that, hey, we're here for you and there's information, we see you. And do you have any other general advice or thoughts you want to leave us with that you feel could be helpful?
My main message is you can live a fulfilling life, a purposeful life as a woman who's childless, not by choice. It's not about, you have to be positive all the time. For those who know me, I'm like totally anti-toxic positivity. It is about learning how to carry that sadness, that grief, and embracing the joy in your life. So I never want someone to think, you have to just be happy all the time, because nobody's happy all the time.
Right.
Everyone has some kind of loss in their life. So that is never my message, that you need to learn how to just forget it and be happy. But it is possible to carry that sadness, to honor that loss, and live a fulfilling life. And so that is really what I want women to know, that, you are worthy. You are not less than. You are allowed to feel all of your emotions, including the frustrations, the sadness, the anger, and happiness. And it is possible to do both.
I love it. Thank you so much, Gail, for coming in and talking with me today. You've provided a lot of helpful information and resources, and I'm just so thrilled to know you're out there helping women with this issue. So thank you so much. I'll post all of Dr. Miller's information in the podcast information. So if you want to get in touch with her, find out more about her, get more information, you can do so. Thanks so much, Gail.
Thank you. Again, thank you for shining a light on this.
Thank you for joining me for today's GynoBits podcast. If you like this podcast, please like, subscribe, and share. Just a reminder that this is not medical advice and you should consult with your personal physician. Also, the opinions and views are mine only and do not reflect those of my employer. If you would like more information or to consult with me, please go to my webpage, healthiermenopause.com. You can also find me on Instagram at Healthier Menopause and Facebook, Menopause MD.